Repetitive strain injury causes and treatment. Repetitive strain injury has been around since people first began repeating motions and carrying out manual labor. It refers to when repetitive actions causes pain in the tendons and muscles. The first description of repetitive strain injury came from an Italian physician, Bernardino Ramazzini, in 1700. He described more than 20 categories of repetitive strain injury that he observed in the industrial workers of Italy. Today, the main causes of repetitive strain injury are manual labor, office work, and the use of modern technological devices. Examples include BlackBerry thumb, iPod finger, PlayStation thumb, Rubik's wrist or Cuber's thumb, stylish finger, reverse wrist, and Emacs pinky. The range of repetitive strain injuries is wide, but this video will focus mainly on those caused by working environments, sports, and the use of modern devices. What is an repetitive strain injury? Repetitive strain injury refers to a wide variety of problems, and repetitive strain injury can affect almost any movable part of the human body. Repetitive strain injuries are associated with repetitive tasks, forceful exertions, vibrations, mechanical compression, and sustained or awkward positions. Other names include repetitive motion injuries, repetitive motion disorder, cumulative trauma disorder, occupational overuse syndrome, and regional musculoskeletal disorder. Symptoms. Repetitive strain injury has many possible causes and a wide range of possible symptoms. Here are some of the more general symptoms: tenderness or pain in the affected muscle or joint, a throbbing or pulsating sensation in the affected area, tingling, specifically the hand or arm, loss of sensation, loss of strength. Other symptoms depend on which part of the body is affected. Causes. The causes of repetitive strain injuries vary widely. Here are some activities and equipment that can increase the risk: overuse of a particular muscle or group of muscles, vibrating equipment, working in cold temperatures, poor posture or a non-ergonomically designed workplace, forceful activities, holding the same posture for prolonged periods, direct pressure to particular areas, carrying heavy loads, fatigue. Increased psychological stress has been shown to worsen repetitive strain injury. Diagnosis. A doctor will normally be able to diagnose an repetitive strain injury through a physical examination and by asking questions about the sort of repetitious task the patient does regularly, what causes the discomfort, and when it tends to happen. There are two broad types of repetitive strain injury. Type 1 repetitive strain injury is a musculoskeletal disorder. Symptoms usually include swelling and inflammation of specific muscles or tendons. Type 2 repetitive strain injury has a range of causes. It is often related to nerve damage resulting from work activities. A type 2 repetitive strain injury will have no additional symptoms, just a general feeling of pain or discomfort. It is sometimes known as non-specific pain syndrome. Treatment. The causes and symptoms of repetitive strain injuries are varied, so treatment also varies. Types of treatment that are commonly used include medication. Anti-inflammatory painkillers such as aspirin or ibuprofen, muscle relaxants, and antidepressants may help. Sleeping tablets may be suitable if sleeping is affected. Heat or cold. Applying heat packs or ice packs. Avoid excessive heat or applying ice directly to the skin, as this can burn. Splints. Some people use an elastic support or splint. Physical therapy. This includes exercises, manual therapy, bracing or splinting, and advice on adapting activities to cope with task or reduce the risk of worsening the injury. Steroid injections. These are only advised if there is inflammation associated with a specific medical condition, as they can have adverse effects. Surgery. As a last resort, surgery can correct problems with specific tendons and nerves. Prevention. It can be difficult to prevent an repetitive strain injury from developing or worsening if the cause is related to work or other necessary activities. The main way to reduce the risk is to stop or reduce the intensity of the activity. If the activity cannot be stopped, tips for reducing the risk include taking breaks. Taking regular breaks from a repetitive task can help. An alarm can act as a reminder to take short breaks. Stand up. Standing up and stretching frequently can reduce the risk. Extend the back, arms and fingers. Eye break. Rest the eye muscles by looking up and staring for a moment at objects in the distance. General health. Eat healthfully and get regular exercise to keep your body resilient, and avoid smoking, as this reduces blood flow. Guidelines for computer and desk workers. The most common cause of an repetitive strain injury nowadays is using a computer or sitting at a desk. The following guidelines may help prevent the most common complaints. Ergonomics. Ensure that the desk, chair and screen are aligned in an ergonomic fashion. Employers will have access to official guidelines. Posture. To avoid slouching, keep the ears and back in a straight line with the pelvis. Wrists. Avoid bending the wrists and keep the arms, wrists and fingers aligned when typing. Typing. Avoid hitting the keys too hard while typing. Touch typing can help, as each finger will take its fair share of pressure, and there is no need to keep looking down at the keyboard. Voice activated software can also minimize typing. Shortcuts. Keyboard shortcuts can reduce typing and mouse movements. Mouse. Do not grip too tightly and slow your speed to reduce muscle tension in the hand. Temperature. Ensure you are working in an appropriate temperature. Telephone. For those who need to type while using a telephone, wearing a headset is better than clamping the receiver between the head and the shoulder.